According to the CDC, resistant bacteria cause more than 23,000 deaths and 250,000 cases of serious illness every year in the United States. And this is merely a subset of a larger worldwide problem that is expected to worsen. One of the principal reasons for the widespread incidence of wound infections, including serious strep pyogenes or flesh-eating bacteria, and invasive resistant staphylococcal infections, or MRSA, is the conventional topical antibiotics, which do not penetrate protective sheaths called biofilm, which protect these resistant bacteria from our immune defenses, allowing wound infections to begin and spread. Further compounding the problem of antibiotic resistance is the recently discovered fact that bacteria of different species can actually share their antibiotic resistance genes, allowing one strain to worsen the impact of other bacteria in the same wound. The CDC has expressed concern that sharing of resistance genes could worsen an already urgent problem, rendering organisms like already virulent MRSA even more serious. Over the past 10 years, medical scientists have begun to unravel the sophisticated strategies that bacteria utilize to render useless the antibiotics we depend upon for protection. We now know of at least 4 methods that organisms use to render our best defenses useless. Bacteria are now known to be able to create pumps that effectively flush antibiotics out. They also create specialized enzymes that can inactivate antibiotics directly. They are capable of modifying their cell surfaces to prevent antibiotic absorption, and they even possess the ability to modify the proteins that are the internal targets antibiotics are designed to hit. As our understanding of the ways in which bacteria actually live on and in human tissue has become clearer, an appreciation for the strategic defenses employed by bacteria has increased exponentially. What is clear is that the methods used to prevent and treat wound infections must change if we are to be successful. TetraNext is a patented formulation providing the proven broad-spectrum killing power of tetracycline, empowered via an innovative penetration enhancement and resistance inhibiting transport system. By providing deep penetration, TetraNext can reach bacteria where they would elude conventional topical antibiotic preparations. Via this same delivery mechanism, antibiotic penetration into the bacterial cell is hundreds of times higher, improving kill rates and reducing potential for resistance by overwhelming typical bacterial resistance mechanisms. Finally, TetraNext provides a 24-hour reservoir effect. TetraNext places the active ingredient where it is needed, with up to 5,000 times greater concentration inside bacterial cells than can be achieved via oral antibiotic treatment. Kill rates are higher, and bacterial defenses are overwhelmed, preventing. Through its patented site-specific penetration technology, TetraNext effectively kills free-living planktonic state bacteria, as well as the more important and difficult-to-treat biofilm bacteria. In the critical interval before wound infection sets in, broad spectrum is absolutely key. Where conventional and even popular prescription-only topical antibiotics have very limited spectrum of action, TetraNext has an unparalleled broad-spectrum action, providing maximum assurance against wound infection across all of the bacteria typically associated with serious wound infections. TetraNext is, in fact, the broadest spectrum topical antibiotic available today, with or without a prescription, effectively covering methicillin-resistant Staph aureus, methicillin-sensitive Staph aureus, strep pyogenes and strep pneumoniae, Vibrio vulnificus, Pseudomonas, Klebsiella, Brucella, Enterobacter, and even the bacteria which causes plague, Yersinia pestis. Even the bacteria which causes Lyme disease, in fact, Borrelia. Critical to successfully preventing wound infection is duration of action. Through its site-specific penetration technology, TetraNext continues to provide effective tissue antibiotic levels for 24 hours, allowing for convenient single daily dosing without worry over waning effectiveness or breakthrough bacterial growth. TetraNext is portable with convenient unit dose plastic ampules that can be carried in a pocket, purse, or backpack, ready for use when needed. Simply remove the desired number of ampules from the box and keep the remainder in the medicine cabinet. A 2-year shelf life means TetraNext will still be effective when you need it most. As this slide illustrates, TetraNext is a unique solution to some of the most challenging wound infections. In the case illustrated, an elderly patient with severe peripheral arterial disease and type 2 diabetes developed open wounds of several toes, which extended through full skin thickness into the toe bones, causing osteomyelitis or a bone infection. These infections are notoriously difficult to treat, especially in the presence of peripheral arterial disease or poor circulation, which prevents adequate amounts of antibiotic from reaching the affected tissue. By utilizing the unique broad-spectrum penetrating characteristics of TetraNext, resolution of infection was achieved, along with full wound healing without evidence of recurrence 6 months later, an extraordinary result which prevented many potential complications, including amputation.